Hello, everybody. Um, First of all, I would like to ask you a question. Would you be happy to be part of the solution to problems in Africa, especially when it comes to healthcare problems, specifically in Ghana? If you are interested in that, then I think you are at the right place. So you are welcome to my presentation. Basically, I'm just going to talk about data cure solutions and one viable solution that we have actually come up to solve a very critical problem that we have in our healthcare delivery system in Ghana. Now, these are our team members. My name is Michelle Amnadrai, and I'm the data analyst. We have Jasmine, who is also our backup data analyst. We have David, who is our UI UX designer. We have Enoch, our UX researcher. Then we have the great Abigail Safo, who is our project manager. And then we have Margaret Tamaklu, who is our project manager. This is the team and the brain behind Data Cure Solutions. So join me as we dive into the solutions that we have propounded for a problem. So now in Ghana, when it comes to our public health facilities, there has been a very big issue when it comes to data management. So what I mean is, if you step into a public health facility, especially in the rural area, some of the things you are likely to see is the fact that most of the data that they collect is still in a manual way, that is our written way, in folders where they have to go and retrieve your folder, give your folder to the doctor, and then the doctor would have to use that to be able to make inferences based on your history and diagnosis. And that is something that has been played in our healthcare system, especially for the rural areas. Now, this way of collecting data is quite inefficient because it can lead to a lot of misdiagnosis if some of these folders that we are looking for gets missing, if some of these things are not found. I mean, it leads to a lot of compromised healthcare services. So this is very important. I mean, our public health facilities struggling with inadequate data management is a very big problem that I think it's high time we tackle as a nation. I mean, if you look at it, there's something we call Human Capital Development Index, where that index is an index that is able to calculate the health of the economy. And one critical arm of that Human Capital Development Index is our healthcare system. I mean, if you take care of your healthcare system, it's going to have a lot of rippling effect on the economy and on the household level. It's going to have a lot of effect on the welfare system. So it's very important for us to be able to address this problem of inefficient data management systems in Ghana, especially our public health services. Now, there's a personal story that happened to me personally. That's how come we came together as a team to solve this problem. I mean, growing up in China, I mean, I'm from the Upper East region, and growing up there, I was close to one of my uncles who was the assemblyman. But one issue that he had was he had a son who was a sickle cell patient. And because of that, he had to be frequently to the hospital as much as possible because he easily got sick. And now Anaba had a particular folder where every single time there was a record of what illness he faced over the period of time that he was, I mean, he visited the hospital. Now, one time, unfortunately, as a result of the flooding situations in the north, when Burkina Faso opened their dam, it has an effect on most of the communities around, and China is one of those communities that get flooded. We got huge flooding and it destroyed a lot of our record keeping system, especially in the hospital. Unfortunately for Anaba, his son also fell ill within that same period of time, and he had to be sent to the hospital. And to the clinic, that's a primary healthcare facility. And upon arriving there, we realized that most of Anaba's files was part of those that were destroyed. And as a result of that, it was very difficult for them to treat him because, unfortunately, too, there were new doctors that had come, and it was very difficult for them to follow and get the right care for him. And unfortunately, when that's Anabe's son lost his life, and that incident has struck me and has been with me for a very long time. I mean, being close to Anaba, I know how difficult it is to lose a child to some inefficiencies as that. So since then, I have been thinking of trying to see if we could bring a lasting solution. And fortunately, I have a very strong team. I'm part of a very strong team that also believe that, and this team actually encouraged me and helped us bring up a certain solution to this problem. But before we look at that solution, we have to look at what has been done. I mean, what is the literature that has been done? What research has been done into this? And you can see that there's actually a lot of studies, but these are the few studies that we point out to. In Ngozi et al., he said, when you look at Africa in general, in our inadequate data management system actually leads to misdiagnosis and delay treatment and poor disease surveillance. And I mean, that is very true. You also look at Obodai. Obodai actually says there's huge infrastructure shortcomings in our public health care system. And these are proof of what we are talking about when you look at data supporting what we are saying. One crucial or critical data that I think supports what we say is looking at the amount of money that has been dedicated to health expenditure as a country. It's quite surprising that from 2000 to 2020, you realize that the maximum amount of money that has been actually given for current health expenditure is about a little less than 5%, which is quite appalling for a big nation like Ghana. So if we are dedicating less than 5% of our income, and this data is from the World Bank data, if we are dedicating less than 5% of our GDP to healthcare expenditure, then how are we going to develop as a nation? How are we going to develop our health care system? How are we going to bring up new infrastructure that can make our healthcare facilities efficient? And that is that's the problem we are facing now. Currently, the latest figure that we have from the World Bank is a 2020 figure, and that is around 4% of our GDP that is dedicated to current health expenditure, which is quite appalling for a developing nation like Ghana. Now, we now go to specifically the facilities. I mean, this what we did initially was a macro level. So on the micro level, we have a research institute or a research group from the Ghana College of Physicians and Surgeons embarking on a research to look at the number of facilities that actually have functional computers. These were questions that were distributed to about 67 facilities. And when you look at the chart, you realize from the blue, that is the frequency, the total number of facilities that said yes, they had a functional computer. And then when you look at the orange, it tells you the frequency of the facilities that actually have. So no, that's a percentage, sorry, the percentage of the facilities that actually have functional computers. And you can see that about 70% of the facilities do not have functional computers. That is a very big problem, because if 70% of these facilities do not have access to these functional computers, how are they going to be innovative to come up with ways to be able to keep data on, digitally? Because what it means is these 70% or these facilities still rely on the old way of actually keeping data. And that is a very huge problem. And I think it's something that we have to look at as a country. So as a result of that, our team at Data Cure Solutions actually sat down and said, no, we'll have to look at a solution to this problem. We have to come up with a solution. And we came up with a group of solutions, but in the end, this was the most viable solution that we found. We found that the best way to tackle this is to be able to establish a cloud-based electronic medical record system. I mean, this cloud-based electronic medical record system is a record system that is going to be tailored to each facility. Now, we've identified a district where we want to work with, which is a Asai Osudoku district, where we plan to run out this solution, try and then establish this EMR system for each primary healthcare facility there. And one very important aspect of our EMR is the fact that it's basically what it does is it gets the information of the patient the moment the patient enters till the patient exits. Now, as the patient leaves the hospital, that information is stored safely on our cloud-based service, which is intertransferable. What I mean is for all facilities, primary healthcare facilities in Child Sudoku, they should be able to share the data, meaning if Michelle, I'm able to enter into, I come as a new patient and I come to facility A, and then for some reason, the next month I go to facility B. What it means is I should be able to, I should basically be able to access my information on facility B, basically. That's it. Yeah, so that is the proposed solution, trying to develop a cloud-based electronic medical record system. And the system will be ideal for solving the problem of our inadequate data management system. Now, we've developed a prototype and we've actually shared it with our users who we gave us feedback. This is the prototype that we have. This is just in its raw form. Just trying to understand basically how it works. So it is a computerized based system where you log in through your URL. When you enter your URL, you are able to, I mean, the first page that you get is the login. You are able to get the username, the passport, the password, and we have our OPT. Now, this is accessible to all individuals in the hospital, I mean, all medical staff, and also non-medical staff like the receptionist. So as I said initially, so for instance, I'm a new patient, Michelle has entered the hospital. Now, when I enter, the first point of contact is the receptionist. I'm like, oh, okay, my name is Michelle and I came here for this. I want to access the service. The receptionist is able to log in to the first page. After logging in, he's able to go to the dashboard, which gives you the ability to actually, first of all, log in or register in a new patient. So that since I'm a new patient, I'm going to be using, or she's going to register me in. And after clicking on the new patient, what happens is we are able to get I mean, a screen where you can get all the information or you can input all the information. So my name is Michelle, my age is da da da, whether I'm male, female, or transgender, we put it there. Marital status, I mean, occupation, nationality, blood group. We get all this information and put it in as a form of registration. Now, in the end, a unique ID is going to be generated for me, and the patient is successfully registered. So this is the output. It tells you that, okay, Michelle, you have been able to, we've been able to register you. So the next point of call is to go and see the nurse. We go to the nurse inputs my unique ID, and voila, the details that the nurse needs to input, that is my patient vitals and all is there. So the nurse goes to the patient vitals, puts in my vitals, my BMI, all the important things that I would need before I see the doctor. After that, I go and I see the doctor. I go see the doctor. The doctor gets my history. Since I'm not there, that will be the first history that will be created, be able to put my details there. And afterwards, I go and I see the lab. After I see the lab also has a similar interface that puts in the information. Then I go back to the doctor prescribes drugs. I go to the pharmacist has a similar system that is able to retrieve or gets the medication that the doctor gave to me. And in the end, after I get my medication, that is the whole structure I've been able to leave. And this is for rural areas. So I've been able to, they've been able to get my details from the point of entry to the point of exit. Now, interestingly, after I'm gone or after I've been able to get my service, this information is going to be saved on a cloud-based system in the sense that in the cloud is able to be accessed by other facilities so that when in case I go to so some of the facilities that we have at Shai Osudoku, we have the Shai Osudoku Clinic, and we have the Agomeda Health Center. So if I go to the Shai Osudoku clinic and then the next week I'm closer to the Akomeda health sector, I don't need to go and start all over. I go to the Akomeda health sector and their health center, and they're able to retrieve my details, and I can work there seamlessly. They can render very good service, and that improves some level of efficiency. So we created a prototype and we tested it in one or two facilities in Shai Osudoku, and basically we got some feedback. So we didn't really, I mean, we got some personnel from Shai Osudoku and some medical facilities and medical assistants who could actually give us useful feedback. And these were some of the feedbacks that we got from them. I mean, they said that navigation and interaction needs to be checked, which is what we are working on as a team. We actually recommend and we love feedback. So we are working on that and trying to see if we can actually incorporate that into the final version, and also the validity of the concepts, trying to see if it's actually feasible in the real life. And yes, we are working day in and day out to make that possible. Now, as a team, we are looking at, these are our KPIs, these are our next steps. First of all, we are going to implement a unified cloud-based EMRI, EMR, and this system we are going to create is within the next 3 months. We are going to get that ready. And to be able to create that and to be efficient, we need to be able to establish a high level of connectivity in terms of internet connectivity. And we are working on that, and we've been able to get that. Another key important aspect is also to get our AI integration into it. And that is what we are also working on. And the last bit for this session is to also try and train our medical professionals, because those are the people who are going to be using the software, who are going to be using the EMR system. So it's very relevant that we train them so that they will be adept with using it, and that would boost some level of efficiency. And also we are trying to look in the interim, looking at patient engagement. We're also trying to see if we can strengthen data security and also establish a research unit that will just be in charge. Then in the long run, also partner with some NGOs that will help us. So finally, if we are successful at Shai Osudoku, we really want to scale it up to all the rural areas in Ghana, scale it up, especially in the north, where this problem is really prevalent. We are trying to see if we can scale it up there. I mean, it depends on how successful we are as a team. And I know we are going to be very successful. So as a recap, we are basically trying to see if we can implement a robust AI-powered system. And it's a robust AI-powered cloud-based electronic medical system. And this is very important because it's going to enhance patient care, it's going to improve efficiency, it's going to improve our data surveillance and public health management. So when we have the breakout of another pandemic, we have data that can help us better understand and better manage some of these things. It's also going to help us improve our cost savings, scalability, and in fact, empowerment of our patients. Yeah, so this is the solution that we have, and we've spoken to some stakeholders, and one of the key stakeholders that we are in talks with is the Minister of Health in Ghana, trying to see if we can actually talk to him and then see if we can get him to actually support us. So this is the team behind, this is Data Solutions, and we are very grateful for spending the time to listen to us. And we hope you are going to also invest in this idea, because Ghana and Africa generally, we need to improve our healthcare system so that in the end, there will be that spillover effect in improving the welfare of individuals and generally the welfare of the country. Thank you very much.